Dr. Alkotob, how are you?
I'm good, Pam. How are you?
Good. I'm so glad that you came on here. Actually, I told you before we kind of started this that I know that you're a busy guy, and I feel super honored that you came in, truly.
Thank you very much. Well, I wanted to make time for you because I think your message is important.
Thank you so much. So I wanted to bring you on. First of all, this is the first of a few doctor series, and you happen to be my favorite doctor. So you had to be first, and it's Heart Month, and you happen to be a cardiologist.
Yes, ma'am. Always have been.
Okay, so real quickly, well, I don't really know you guys. Quick backstory, really quickly, is how I know Dr. Alkotob. I actually work for Dr. Alkotob. I'm the director of his cardiac rehab that we'll talk about at the end of this. But when I started here, I didn't really know. Luckily, I had never had to see a cardiologist before, so I didn't know there was a difference in cardiology. So you specialize in certain things, like are there different? So what's your?
Yeah, so to become a cardiologist, you first have to go through training to be an internist. So you do a residency in internal medicine. Hopefully, you become board certified in internal medicine, and then as a subspecialty, you specialize in the heart. And that is another 3 years of training. But now the heart and medicine has become so complicated and specialized that there are, even within that field, multiple specialties. So you have the electrophysiologist that deal with heart rhythm and abnormal heart rhythms and how you treat them. And you also have the interventional cardiologist like myself. We deal more with patients who have blockages and need them to be opened and have stents and treating heart attacks. And there are others that deal with heart failure, so forth and so on. But that doesn't mean that as an interventional cardiologist, I don't treat all kind of patients with heart disease. But that happens to be an additional special skill, those who do intervention.
Okay, so where did you go to school? Because some of the people might want to know. Because some people that are going to listen to this will know you. So
I did medical school in Syria, which is now going through a very rough time. But when I came to the United States, I was very blessed and lucky to go to the Cleveland Clinic, one of the best hospitals for cardiac care for over 20 years at this point. So that definitely enhanced my interest in cardiology, and I moved on a lot. I went to the University of Connecticut to do my cardiovascular training, and then I went to Boston University to do my interventional training. And then came back here.
And here you are.
Here I am.
In Michigan.
In Michigan.
Yes. In Genesee County, for those that don't know.
Yes, Genesee County, yeah, absolutely.
Awesome. So for Heart Month, I think we'll kind of just start off you wear a lot of hats. And so that's why I'm so fortunate that you decided to take time today and grateful. But we'll just really talk about some basics. So for my listeners, a lot of them are exercising, but some of us are a little bit nervous about our heart, and we don't know like certain numbers and things like that. So really basic, real basic. So what are like numbers we should look for maybe lipids or blood pressure? So we can start there.
Yeah, the best way to treat heart disease, as you're trying to allude to, is to not let it happen.
Sure.
And if you ask me, people ask what is a modifiable risk factor versus a non-modifiable risk factor. And the most important non-modifiable risk factor is age.
Age.
So while everybody knows that it's wonderful to eat well or eat healthy and exercise, there are other things that you have to watch out for as we age. Some of these things are not exactly under our control because our genetics predisposes to them, such as very bad cholesterol, such as high blood pressure, which is extremely prevalent. Whether you are someone who eats well and exercises or not, you are prone to that potentially. And then finally, patients who could be also predisposed to diabetes. So at a certain time, you have to get checked for all these things besides the modifiable stuff that you can do, which is follow someone like yourself, with good, training and exercise habits and nutrition as well.
Okay, so you're saying like genetics obviously come into a big play, and I've heard the term. I don't know if you heard this term, like genetics load the gun and lifestyle pull the trigger kind of thing.
Perfect. Yes. Okay. Perfectly put.
So there's some preventative things you could do on your side, but if somebody's looking at numbers, because people ask me this, because guys, I do run the cardiac rehab. They'll say, "What's a good blood pressure for me to be at?" And sometimes I have to go back and say, I'm not a doctor or a nurse. I'm
Right.
a director of a cardiac rehab. So there's certain, I know those
well, that's
questions,
humble
but
of you. That's
yes.
humble of you. I'm sure you do know the numbers. But for the public, we are, our guidelines say that we should treat blood pressure when it exceeds 140 over 90.
140 over 90.
That doesn't mean that having a blood pressure of 139 all the time is actually healthy. A perfect blood pressure should be 120 over 80. But let's be honest, many people don't attain that.
Sure.
And many people don't feel well with a blood pressure less than that.
Okay.
So it's always wrong to say that one size fits all.
I love that.
It isn't. But if we want to remember a number to go by, it has to be less than 140 for systolic, over 90 for diastolic.
Okay.
That's a general idea.
So that's less than, and you're saying like treat each person. I love when doctors say that, actually, like treat each person as an individual, because somebody else might feel good at a certain level.
In fact, in the future, and that future might not be that far, well, who knows, cost prohibitive, you know, we will be able to have our genetics examined to know what is perfect for us.
Yeah.
And I think when I teach medical students and residents, I always tell them there is no dogma in medicine. What was right 5 years ago may very well not be true in a year from now. Our, research leads us to always new convictions and so forth and so on.
Yeah. And then, so that's blood pressure. And then what about cholesterol? Because I know you mentioned that. And that's a big thing for people. Like what's the LDL and HDL? And
yeah. In my mind, it's actually the biggest thing.
Yeah.
Because our classic teaching that lower is better. But the guidelines for cholesterol, which, let me explain, when I say guidelines, that's always built on number of research and consensus opinion of experts over years and multiple trials that led them to those guidelines. And this is why those guidelines always get updated, because new evidence comes by. But where we stand right now, that you cannot tell someone this is the most ideal cholesterol for you without knowing their blood pressure, their age, their other risk factors. So it's a moving target.
Yeah.
But in general, let's say someone is healthy, young, and they don't have any problem. We like to see the bad cholesterol, the low density lipoprotein, LDL, less than 100 if possible. But that doesn't mean that we start treatment if someone is completely healthy, even if the level is much higher than that. Okay. We also have to take into consideration their good cholesterol, because the higher the good cholesterol is, the better, that will negate the risk of the other one.
And the total cholesterol will be higher because the higher was...
Yeah, this is the biggest problem I have when people look at that total number. And that number is only meaningful in reference to the other numbers.
Sure.
It's actually, by itself, to me, is meaningless. Yeah. I think you need to know all the other numbers in between. Yeah. The one thing that creates a higher good cholesterol, the only proven way to get a higher good cholesterol is what you do. Daily exercise. Yeah. That is one thing that naturally will increase the good cholesterol.
Consistency over intensity.
Yes.
Exercise every day.
Yes.
At least do something. I love the answer, and that's one reason why I got along with Dr. Alkotob right away, is because of his answers like that. Like, you are not dogmatic about one way. You're very open to, okay, well, this can change and this can change. But obviously you have your areas of specialty. So,
yes.
Yeah. So we kind of love answers like that.
Well, I think care, if we're talking about patients or interacting with people that have questions, there's such thing in medicine that's called shared decision making. And I think most decisions should be led that way, where there's a buy-in from the individual and an advice or a recommendation from the doctor.
From the doctor. I love that. I've actually never heard that before.
Yeah. Shared decision making, it's big.
Yeah, well, it's kind of what you practice, but I guess somebody like myself is not going to hear that term. Maybe, we might just kind of do that with our doctors.
Sure.
Yeah. So those are good points. So let's kind of step into. You already talked a little bit about the prevention of. Let's talk about the signs of maybe a heart attack real quickly, because I know that's a pretty big question.
It is.
And my listeners might want to know that, but they won't know intensively.
Well, so we say men are from where? Mars. Women are from Venus.
Venus.
Yeah.
Are men from Mars?
Yeah.
Okay. All right.
I'm not
sure.
We're not the same.
Okay.
Men have read the book. They come in with substernal chest pain, which is pain in the middle of the chest, sometimes radiating, God forbid, to their left arm, and it comes on with exertion.
Okay.
So that's very scary.
Yeah.
If you're having discomfort in the chest with exertion, do not take that lightly.
Yeah.
On the other hand, with ladies, it can be a very different story. It can be, pain not necessarily in the middle of the chest. It can be a pain that radiates to the right arm instead of the left arm. But I think the issue of a symptom with exertion is important.
Yeah.
And I think if you're able to exert yourself and not have that symptom, that's always a good sign.
Okay, I may or may not have texted him a couple of times asking if he thought I was having a heart attack. He's like,
she was not.
No, I do not think you're having a heart attack, Pam. However, if you need to be seen, I can
You're
probably
welcome.
see you. So I wasn't having a heart attack. Whew,
Thank God.
So women can be a lot of different symptoms. And
figure.
A lot of times it's like anxiety or something. But that's a great point because, I'm not a doctor, but I do read a lot of things, and I notice that they're kind of even studying men and women a lot differently and a lot more in areas, even in areas of muscle and muscle mass and things like that. And the benefits of men and women, because a lot of studies are always done on men.
Yes.
Yeah, so that's a good point.
Yeah, the majority of trials include usually more men, but I think in the past decade we've been paying a lot more attention, and I think there's been so much awareness that you have to pay attention to heart disease in women. I think the one important point to your listeners from what you've asked is it's the saddest thing when I see someone coming in late. They've started having the symptoms and they waited and they waited and they waited 12 hours, 24 hours. We have a say in interventional cardiology that time is muscle. The later you present, the more muscle you have lost. Okay. And so it is always better to err on side of caution and make sure that the symptoms you're feeling, if persistent, are looked at quickly.
Yeah. And that kind of leads into something I'm a little bit passionate about. You may or may not even know this. So I'm actually also a health coach and personal trainer and all these things by trade.
I do know. Yeah.
But I have the ability to run functional medicine testing. I don't ever really announce that. This is probably the first time I've ever actually said that, because I don't believe in a lot of it, because I think we can get too informed on some things that are very unnecessary. And I think we can look too deep into things and drive ourselves crazy, because I know that I can do that even with the small numbers that I do know with the data. But sometimes in the functional medicine world, if you want to separate the two, which I don't think they should be, they will often say, get all of these functional medicine tests run, and then you have all of this information, like things that we don't even know what to do with.
Right.
I don't know how to read half of that stuff. So what's kind of your feeling on that? Like,
I could not agree with you more, in the sense that I tell my patients, a lot of them do come to me, somebody has a family history of heart disease and what have you, and says he wants to be preventative, and then I'll order a couple of tests, and then they'll ask me, well, what about A, B, C, and D?
Sure.
And I'll say,
because we heard it on the internet.
I said, yeah, sure. Yeah. And I said, well, these are all predictors of risk. But let me ask you this, what are you going to do with that information?
100%.
If there's not an actionable item, something I can do to modify your risk, then why get it? Sure. Like if you found out that you are at higher risk, but you're already doing all the things that need to be done. You're getting your cholesterol under good control. You don't have symptoms. And you're exercising. What is the additional nature besides anxiety? Yeah. And anxiety is going to lead to actually a worse lifestyle, and it's going to lead to all sorts of symptoms. Remember, our mind can play a lot of tricks on us.
I'm a big believer in, just because I've kind of went down that rabbit hole a couple of times, and it was not good for me. Yeah. And really, those basics is like, let's just read the basics, like you said. If you're doing everything you're supposed to do, then you can sleep well at night and say, okay, well,
much better.
So that will lead me into the next thing we talked about before this, is kind of prevention. You touch on that, but what's your biggest advice for prevention outside? My listeners are going to know, exercise and all of that. And there's certain general recommendations that we have, but are there anything outside of just, general exercise?
Respect the age. And
Okay.
at a certain age, there are certain numbers that need to be looked at.
Mm-hmm.
That blood pressure that you haven't checked in God knows how long, it should be checked. And if
Yeah.
it's not good, it should be treated.
Yeah.
You know, one of the most devastating consequences of untreated hypertension is actually stroke.
Oh, wow.
And stroke is debilitating, and it is something that can very well be prevented if treated. Know what your sugar level is, or your what we call hemoglobin A1C, something to look at a long term of blood glucose. Treat it if need be.
Mm-hmm.
I have a friend who was a physician, and you see, he wasn't feeling well for the longest time, and you know, he wasn't like particularly overweight or there was anything unusual or unhealthy about him, but he happens to have the genetics to have type 2 diabetes, and he found out that his blood glucose has been high for so long and he didn't even know.
Oh, yeah, because you never got it checked.
He never got checked. Finally, know what your cholesterol is and treat it. Now, there's a lot of bad rep on the internet for the medications that reduce cholesterol.
Mm-hmm.
And without getting into details, a lot of it is true.
Mm-hmm.
What is not true is the percentage of how often that negative side effect happens, number one. And number two, what is not true is not recognizing what you're losing by not taking the potentially small side effects.
Sure. Risk.
So
versus
again,
benefit.
exactly. So that's again a shared decision making. It's got to be talked about. If we end up with a bad outcome, but you are knowledgeable of your risk and you know what chances you took, that's a whole different ball game than having your cholesterol be high for 10 years, not knowing about it, and end up with a heart attack.
Right. And like you said, age kind of does play a factor in that, no matter if we want to deny that or not.
It's a non-modifiable risk factor, people.
Yes.
Non-modifiable. We can't get younger, not yet at least.
Yeah. So basically, just general prevention, like like we talked about, exercise and keeping your numbers and keeping your age in mind. That's really great.
Yeah.
That's great information. Because I don't even think about that.
I heard something that was put in a meme from overseas that was actually quite interesting. He said, if you're 40, eat less and exercise more. If you're 50, stop talking to toxic people. Yeah. And I can't remember what it was. If you're 60, I don't know what it was, but it was something like that. So
each year you cut something else
yeah,
up. Yeah.
Each decade. But psychology, actually, being around negativity is definitely, not good.
Yeah, I've shared this a couple times, and I get really basic with this. Someday I'll go in depth, but my mom died of stress, and I'm a firm believer in stress management, and that's actually, we can kind of go into that into the rehab on that note. So I'm the director of your cardiac rehab, which happens to be a lifestyle medicine clinic. It's the only one in Michigan that we have, which is pretty cool, and I'm pretty proud of that.
Yes.
And so stress management is one portion of our program, but it's an intensive cardiac rehab, for the medical term. And I like to more talk about it with patients as a lifestyle medicine kind of clinic and a wellness-centered cardiac rehab. Again, I'm very proud that we have that here in Michigan, and always honored to be here to get to help patients in that manner. Because I think as a fitness coach, and you talked about this when I first met you and you hired me, and we don't get a lot of opportunities like that.
No.
To be able to one of my dreams is to bring the medical field into health and wellness, and this is really the best step that we have right now. Yeah. That's it.
So let me start by saying, if I ever wanted to start that cardiac rehab, it couldn't have launched or survived despite COVID and the difficulties that come with it if it wasn't for you. So much respect for your passion on it, for your persistence and leadership. That really shined through and really held that program together, 100%. Secondly, you're exactly right. I mean, we have a huge difficulty, and we are in Genesee County, which, we're not the most economically fortunate areas. But we have patients that need our help, and they don't get that kind of help almost anywhere else. And you just mentioned it. All the state of Michigan does not have an intensive cardiac rehab. The focus is on simple, come here, go on the treadmill, do half an hour, you're mounted, go home. None of the other aspects, not the stress management portion, not the nutrition, nor the personal attention to exercise that you provide.
Yeah.
Which I can't really give a blanket judgment, but I don't see it in all other rehabs. But wouldn't it be wonderful if that model was taken before heart disease happened?
Prevention.
Prevention. Yeah. Wouldn't it be wonderful if we would be able to provide that to people who really are struggling in achieving their own prevention, and we bring them and we teach them and we start them with these good habits and then send them over on their life? How much savings to the healthcare system will happen if you take that very small initial cost in favor of preventing extremely costly health consequences? Not only we can't do that, we can't even get coverage for patients who did have heart attacks, who are in heart failure, who did have bypass surgery.
It's the biggest hurdle.
Because just insurance chooses, not to cover.
Yeah, and we're not even a prevention at this point, like you said. They have to have some qualifications and have some diagnosis to be able to be referred to our program.
Yes.
But the prevention part would make sense in all aspects, and that is actually, I think, and this is a conversation in my kind of fitness space and wellness space, is that's true health care. Like, when you see somebody that's sick, they say that's sick care, and then there's health care. I think health care is prevention and teaching, and you do an outstanding job with patients, educating them as much as you can with the small amount of time that you have with them on proper exercise and nutrition. Every one of the patients that we get from you do say that they've heard you say that, or as biggest thing is, you have to stop smoking. Like, they always say, like, Dr. Alkotob's going to be so proud I picked a date to quit.
Yeah, we didn't talk about that, but you brought it up. I mean, this is this is not a silent nor a secret or a mystery killer. It's an open out there. It's a killer. Yeah. And I know in Michigan, people also work with some recreational stuff. It's just that the smoking aspect is so detrimental.
Oh yeah, and that is actually, that's a great point that we didn't talk about, and that's what I did want to talk about is and I've seen you do a couple segments even on local news stations about even the dangers of vaping, and we have patients come in and think that that's better, and I 100% look them straight just like this, and don't inhale anything. That's strongly discouraged. So there's ways that we help them with that. You guys as physicians can help them, with medications and whatnot to try to help them get off that. But that's
there are options, but definitely not starting. So kids, wherever you are, don't start. Not starting is the best way. So again, prevention, and then there are some things that you can do to help. But it really is mind-boggling. You bring up a good point. Why is it that all the things that prevent you from doing something bad are not ever covered? And the only thing that's covered is always the consequences. Sick care. And
that's unfortunate, because in the wellness space, and I would say wellness and fitness space, Dr. Alkotob doesn't have much time to be online, you guys, because he's actually out here working. So
that's exactly right.
So the fitness and wellness space, there's a big conversation, of kind of distrust in doctors because of that kind of holistic mindset, and they kind of think like, oh, these, they want to go around doctors because you guys don't have much time with patients. You can only give them so much. So a program like that preventatively would be amazing, because that's something, if you only have 10 minutes with the patient and there's a few things, maybe they have obesity, or maybe they're prone to those types of things. If you could enroll them into a program, that is your second step. That's where like health coaches can come in with, and that's a dream.
I think you and I spoke before about how can we make this available for the public and still afford it. Yeah. I mean, because it's not cheap. This is not cheap, guys. Honestly, it's a hell of a lot cheaper than one single visit to the emergency room. But
people don't see it.
Well, it's not that people don't just see it. Also, understandably, people may not afford it.
Yes. And insurance companies.
Insurance companies have every incentive to cover something like this in order to save a boatload of cost down the line. So it is, one of those mysteries, and maybe our healthcare one day and our health advocates and people like you will bring it to the forefront where it will become, ironically, so this is important, Medicare does cover for our program, obviously, if you're sick, not preventative.
Yes.
They do in Hawaii.
Yes,
I don't know
Hawaii
how.
is the only prevention program.
Yeah.
Covered is Hawaii Medicare.
Yeah.
Yeah.
But even when Medicare becomes a managed care plan, they stop covering for it.
Wow.
Yeah.
Yeah.
That's what we've seen. So we actually we survived COVID. Mm-hmm. We have less patients now than we had pre-COVID.
Yeah.
Because Medicare went to this managed care plans.
Yeah. So there's.
We're not here to talk about our program.
We are to talk about the program because that's a lot of my listeners kind of know that I do that, but not all of them, and some of them do have questions about that. So in our program, we teach stress management, nutrition, we have exercise, and then there's the group support.
Counseling,
the group support, which surprisingly a lot of people end up liking after a while. So that's all kind of the prevention part of it. So I guess lastly, because I know you have to leave.
Sorry, we'll do this again.
I'm going to have him on again. Don't worry, because I'm sure we'll have questions, and it's always lovely to talk with you. What's your favorite exercise and way to stay healthy? Because he has some interest in athletics, but what's your favorite way? What's your favorite thing now, and what would be ideal? Because that's different for all of us.
How about I'm going to change the question, so it's not
okay.
personal.
You can change the question.
I think people underestimate walking.
Okay.
A lot. Mm-hmm. So, sorry to put you on the spot, so
No,
I'm going to reverse this on you.
You can.
So you guys are looking at a top-notch athlete who, for reasons that will remain, to her, does not run.
Yes.
But she does a lot of walking, a lot of stepping, a lot of incline walking. Mm-hmm. And I think if you have the time, I don't care what speed you do, but walking for more than 30 minutes, if you're healthy, is amazing.
Yeah.
And if you are not, and you're not able to, walking in intervals for any period of time is good. I think we stay healthier if our lower body is able to carry us and keep walking.
Yeah.
So I think that would be my favorite advice.
Okay.
And I'll leave my personal favorite out. Okay.
You're not going to share us
We'll
what you love to
next
do.
time. All right.
Okay. All right.
Till next time.
Dr. Alkotob, thank you so much for coming on. Seriously, it was a pleasure.
It was my pleasure. It's actually a very nice discussion, so we should do it again.
Yes, absolutely. We'll have some questions. So don't forget to like and subscribe and share this episode with everybody that could benefit from it, which is everyone alive, because we all have hearts. Yeah. So
I hope the left side was my better side.
Next time we'll get it from the right and we'll compare. All right. Thanks, you guys.